Some people may tell you it doesn't matter where you go to medical school. A medical degree is a medical degree, they'll say, and your patients won't care where you got it. That's one way to look at it, but it may not be the wisest or most advantageous for you. If you're bound and determined to become a doctor, you have already identified yourself as a special person. You owe it to yourself to set your sights high. Every year, U.S. News & World Report surveys medical school programs all over the country and comes up with the top 25 for both research and primary care. These are the schools you should strongly consider targeting. Top schools have the best curricula and most accomplished faculty. Their technology and research are cutting edge. Their reputation will open doors for your entire career. Fellowships will be more accessible to you, along with research opportunities and positions in the most important hospitals. The competition for top residency programs is fierce. Many factors are taken into consideration, including performance on U.S. medical licensing examinations, grades, and letters of recommendation. But another factor is the quality of the medical school attended. So as medical school applicants consider their application list, they should include those medical schools as much as possible with the best-known name recognition and tradition of academic excellence. Top schools also have top financial resources. They often go the extra mile to make med school affordable for all students. When you step up on graduation day to receive that well-deserved diploma, you may find yourself with much less debt had you attended a less esteemed school. The stats bear this out. The average indebtedness for 2008 medical school graduates was $155,000. However, the average indebtedness for 2008 graduates of the top 25 research schools was only $116,000, and the average indebtedness of 2008 graduates of the top 25 primary schools was just $131,000. Debt hovered just above $100,000 for graduates at such prestigious schools such as Harvard, Duke, and Washington University in St. Louis. It was less than $95,000 at Johns Hopkins University, and an amazing $86,000 at Stanford. Top medical schools go out of their way to attract top students regardless of their financial situation. At University of California, San Francisco, for instance, 89% receive some form of financial aid, and 87% receive either grants or scholarships. The University of Michigan supports 1/3 of its students with a total financial aid package, and is committed to increasing that number. At Washington University, there are special fellowships for those entering the Medical Scientist Training Program. You will want to carefully research the top medical schools to find the ones that best suit your needs, interests, and career goals. For example, Washington University has a long history of medical firsts, including inroads in diagnosis and treatment of Alzheimer's disease. University of Michigan offers first semester access to patients and a clinical simulation center that provides hands-on experience in birthing, endoscopy, vascular intervention, and more. Stanford is a research-intensive medical school that integrates basic science and clinical experience with in-depth and independent study. The list of perks goes on, so don't let anyone tell you not to aim high. When it comes to medical school admissions, how will you know which schools might be a stretch? What are your strongest story themes and wow factors for your personal statement? Which recommenders will have the most impact on your application? How will their recommendations, along with your resume, give the admissions committee a holistic review of your candidacy? Call us at 703-242-5885 to learn how admissions consultants can help you develop a medical school application strategy that will make the most of your background and your potential.